Thank you for the kind introduction. The topic given to me is SGLT2 inhibitor and safety in Ramadan. So this is the hospital that I practice. The population in my area is Muslim majority, and this is the view outside my hospital. I have nothing to declare pertaining to this talk. In the next few minutes, what I'll do is we will review back the guidelines on SGLT inhibitor use during Ramadan and follow with looking through some evidence in terms of SGLT2 inhibitor use in Ramadan from year 2022 to year 2023. In the recent years, many international societies on diabetes, cardiology, and nephrology has indicated SGLT2 inhibitor as first-line therapy for patients with cardiovascular and renal diseases. And this indication is extended into people that has no diabetes. SGLT2 inhibitor is agents that promote glycosuria. So there is some concerns about its use during Ramadan as it may promote volume depletion where patient may become dehydrated and leads to acute kidney injury. While the medication itself does not cause hypoglycemia, but it can potentiate other medications like sulfonylurea or insulin, hence leading to hypoglycemia. And of course, it can also lead to diabetic ketoacidosis, particularly even the blood sugar is normal. So hence, there is a segment in this Diabetes and Ramadan guidelines published in 2021 on SGLT2 inhibitor. And it says we should initiate SGLT2 inhibitor 1 month to 2 weeks before the start of Ramadan. And if the indication is for cardiovascular or renal protection, we should initiate at the lower dose if it is available. And changes to the timing includes taking the pills at iftar time and to compensate fluid intake during the non-fasting period, so to overcome the dehydration effect. Generally, the medication does not need to be adjusted in terms of the dosing. However, if there is a medication that may promote hypoglycemia, and the HbA1c of the patient is normal or near normal, we should consider reducing those medications dosing. Next, we'll move on to the second segment, looking at the latest evidence update on SGLT2 inhibitor in Ramadan. We are going to focus only on the safety issues. So what I did is doing a PubMed search on the term SGLT2 inhibitor and Ramadan over this period of time. First study is published in Egypt, looking at SGLT2 inhibitor and dehydration. This study is an observational study, and the intervention group is empagliflozin and dapagliflozin, which consists of about 80 patients, and the control are those without SGLT2 inhibitors. Outcome measured is to look at hydration status, clinically and biochemically. So the authors reported that there is a change in the body weight from baseline to during Ramadan in those patients receiving SGLT2 inhibitor. So these changes is significantly lower compared to the standard of care. Similarly, mean blood pressure showed reduction in empagliflozin and dapagliflozin group compared to standard of care, and the p-value is significant. The authors also reported that higher urine-specific gravity, higher serum osmolarity, and also higher urea creatinine ratio among those taking SGLT2 inhibitor compared to standard of care. So to sum it up, the authors reported that this taking SGLT2 inhibitor during Ramadan may increase the risk of dehydration. Second study is from Pakistan, also looking at the safety and efficacy of SGLT2 compared to DPP-4. So the intervention group include empagliflozin plus metformin, and the control group are sitagliptin and metformin. The outcome measure is hypoglycemia. Other secondary outcome looking at dehydration and genitourinary infection. Patients were given logbook to record the symptoms for hypoglycemia, postural giddiness, hypotension, as well as UTI. So for the primary outcome, let's focus on the bar in blue. So the authors reported that there is no differences between the incidence of hypoglycemia between empagliflozin and the DPP-4 group. Looking at the SGLT2 arm, you can also see that there's no reported cases of UTI, and the dehydration incidents are similar in comparison to DPP-4 inhibitors. So the authors concluded there is no increased signal of hypoglycemia, urinary tract infection, or effect of dehydration for subjects taking SGLT2 inhibitor during Ramadan. Moving on to a third study. This study is from Bangladesh, also looking at the efficacy and safety of SGLT2 in Ramadan. So let's look at the study. So this is also another observation study. And by far, this is the largest study with the intervention group consists of 274 patients on empagliflozin, and the control group are those without SGLT2 inhibitors. Outcome measure includes HbA1c, weight loss, hypoglycemia, and the secondary outcome are adverse effects. So adverse events. What we are going to focus is actually on the adverse events, yeah? Okay, so the authors, these two comparison between the empagliflozin and control, you can see that there is no difference in terms of hypoglycemia, urinary tract infection, as well as volume depletion compared to the standard of care. So in short, there is no increased signal of these effects of, as I mentioned before. This study is conducted by my team. So we are looking at empagliflozin use and the effect on volume status, ketonemia, as well as hypoglycemia during Ramadan. So it is also an observation study conducted in single center. So the intervention arm are patients that is taking empagliflozin, and the control groups are those not on any SGLT2 inhibitors. So the outcome measured are dehydration, and the secondary outcome looking at hypoglycemia as well as ketonemia. We use changes of eGFR as a marker of dehydration, and safe to say that there is no increase or there's no differences in the drop of eGFR for subject taking empagliflozin compared to those without SGLT2 inhibitor during Ramadan. And the graph in orange is showing that the incidence of hypoglycemia, and they are not statistically different between these two groups. In terms of ketonemia, they are not significantly different as well. So in summary, our group shows that there is no increased signal of dehydration, hypoglycemia, or ketonemia for patients taking SGLT2 inhibitor during Ramadan. Okay, this is the final study that I will share today. This study is conducted in Saudi Arabia. Again, also this is an observational study, and intervention group are subjects on empagliflozin, and the control groups are those not on SGLT2 inhibitors. The outcome measured are hypoglycemia. The secondary outcome measured are hyperglycemia, dehydration, as well as hospital admissions. As you can see here, let me highlight to you the graph in blue. The authors shows that subjects taking empagliflozin during Ramadan shows significantly lower incidence of hypoglycemia compared to the control group. And looking at their baseline medications, the sulfonylurea and insulin use are similar between both groups. The effect of hyperglycemia, volume depletion, and the eGFR measured are also did not show any difference between these both groups. So in short, the authors demonstrated that the incidence of hypoglycemia for subject on SGLT2 inhibitor are lower. Otherwise, no increased signal to suggest a risk of hyperglycemia as well as dehydration. So I've presented these few studies, and as you can see, most of the studies are using different types of parameters to measure an outcome. So hence, it is a bit difficult to compare them head to head. Generally, the sample size are small and it is observational trial. So with no blinding. So there is a chance that the patient may be over-reporting some symptom or under-reporting the symptoms as well. In terms of volume depletion, it shows a mixed signal with the study from Egypt showing a positive effect of dehydration. However, other studies did not show this effect. So it could be this is a region-specific outcome where subjects or patients living in Egypt usually fast up to 15 hours. So the duration of fasting may play a role here. Furthermore, the locality of the patient located is also very important, like the humidity or the local temperature may also play a role in terms of the risk of developing dehydration. Okay, and then otherwise, all these studies did not find any effect of increased hypoglycemia, urinary tract infection, or ketone increase in terms of the ketone level. So there is no increase signals of these complications. Okay, so before I end, this is the take-home message. As I've demonstrated from the guideline and also the recent evidence updates, SGLT2 inhibitor use during Ramadan is generally safe. So as following the advice, we should avoid starting SGLT2 inhibitor very close to Ramadan fasting. So preferably the gap is between 2 weeks to 1 month before the start of Ramadan. That is the standard advice. And for patient taking this class of medication, be it patient with diabetes or without diabetes, all patients should receive a proper medication advice. So they should ensure they take adequate hydration. And if they are going to fast longer, so they have to compensate the fluid more. And then watch out for the timing of the dosing. So they have to change the medication instead of taking a sahur, changing it to iftar timing, and also to counsel patient when to stop or adjust the medication. So when they are unwell, when they are undergoing prolonged fasting, typically this patient has to stop SGLT2 inhibitor use. So with that, thank you very much. I invite any questions pertaining to this topic.